2012, the FDA approved a disease-modifying therapy for MS, bringing the total number of disease-modifying therapies to 9. The generic name is teriflunomide, and it's being marketed by Genzyme as Aubagio. We had a chance to speak with 2 committed members of the MS community to hear more.
I'm Jim Bowen, and I'm the Medical Director at the Multiple Sclerosis Center at Swedish Neuroscience Institute in Seattle. I've been involved with the Multiple Sclerosis Society for a number of years and served on a number of their committees. Most recently, I've been on the board with the Greater Washington chapter.
My name is Lily Jung Henson, and I'm a neurologist at Swedish Neuroscience Institute. I work with Dr. Jim Bowen and his MS Center at Swedish. I also serve as a national board member for the National MS Society.
Well, people have been looking for many years at compounds that will have an impact on the immune system and how that might affect MS. Teriflunomide is one of these compounds that has been on people's radar for a long time as a potential compound that might affect the outcome of the disease.
Teriflunomide, or Aubagio, is the active metabolite for leflunomide, which has been on the market for 10 years for rheumatoid arthritis. It was designed to be the drug to be studied because it was felt that the side effects associated with the parent drug, leflunomide, would not be there with the teriflunomide. I was involved with the second phase 3 clinical trial for the teriflunomide studies, and we were involved with recruiting patients with relapsing remitting multiple sclerosis who are interested in trying the oral agent. The results from the TEMSO study, which is what allowed the drug to get approved, is that it appears to be very effective in terms of reducing the annualized relapse rates for patients, so the attack rates for patients with MS, and it also had improvement in terms of MRI scan results as well as disability progression. So those are the 3 markers that we usually use to monitor how well a drug does when we're studying them for MS, and the drug appeared to be effective.
I think for effectiveness, it did decrease the attacks that patients had. It decreased MRI activity, and it decreased disability. The interesting thing is that its impact on disability seems disproportionately good in favor of the drug. So I think those are all things that patients have to weigh before they start it. Well, I think it's unfair to compare drugs, the results from one study with the results in another study, because the patients that are enrolled in these studies are completely different. So it's like comparing apples and oranges. But having said that, the attack rate decreased about 30% with this drug. The injectables, the interferons and gluteramine, they have about a 30% reduction, but they were studied 20 years ago, so those studies are very different. The Tysabri and the Gilenya, the fingolimod, those are more in the mid-50s decrease in attack rates. So this one, I think people are going to compare it with the more recent studies of Tysabri and Gilenya. But that's a difficult comparison, as I was saying. Aubagio works by blocking the production of a compound that's needed for cells to reproduce rapidly, so it affects cells' ability to reproduce quickly. This mostly affects white blood cells, so it suppresses those white blood cells, and as a result, it decreases the immune system's ability to attack targets.
It doesn't affect cells that are more normally functioning, like our average normal white cells, and so you don't develop immunocompromise of your white cells. The current feeling about the drug is that it is an immunomodulating therapy. There does not appear to be an increase in serious infections noted in the patients in the clinical trial. The mechanism of action of this drug is different from the other therapies that are on the market. So if someone isn't doing well with the current disease-modifying therapies, this offers another option in terms of mechanism of action.
Aubagio can be used first line. It remains to be seen how it will be used in the marketplace, whether people will use it first line or delay it until other things have been tried first because of the side effects. So with Aubagio, there are 2 doses that were approved, 7 and a 14 milligram a day dose. So I think patients have their choice of which of these 2 drugs or which of these 2 doses to use. The clinical outcomes were similar, meaning that the attack rates and the disability rates were similar between the 2. But the disability rates and the MRI outcomes were more impressive with the higher dose. Well, Aubagio has a number of side effects, and I think patients have to consider these before trying the medication. It has a couple that are black box warnings, which is an indication that the FDA has these 2 side effects that are of particular concern. One of these is related to liver function. There were no cases of liver failure on the studies with this drug, but leflunomide, the parent compound of this, has had cases of liver failure. And because of this, patients need to have their liver function checked every month for 6 months. The second black box warning is for reproduction, and there's a potential for fetal malformations. The half-life of this drug is 18 days, which means if you stop taking the drug by 18 days, your blood level will fall by half. So it takes several months for the drug to be completely out of your system. So if a woman was planning to have a child, she would either need to wait many months, or else the actual recommendation is that you flush the compound out of your body. And you do that by taking another medicine, either cholestyramine or activated charcoal, that actually gives you diarrhea, which flushes the drug out, but you have to do that for 11 days. The other unusual thing about this drug is that those reproductive recommendations apply not only to women wanting to have children, but also men who want to be fathers. So those 2 black box warnings are something that people need to think about. In addition, it has a number of more minor side effects. There have been some infections on this medication, and one in particular, there were a few cases of tuberculosis, so patients have to be tested to make sure they don't have tuberculosis to start with. It also has hair thinning as a side effect.
I've heard that the hair thinning associated with the drug is not too different from what happens with pregnancy. So the hair thins out and then it returns. It usually occurs at about 6 months into drug therapy, and usually by 6 months into that period, people's hair have either returned to normal or are slightly thinner than their baseline. So really it's, you know, the way you think of it is not so much as the hair loss you think of with chemotherapy. It's really when you comb your hair, when you wash your hair, there's slightly more hair in the sink or on your brush than normally you would see. The drug has been approved so far in the United States, and the way I understand a patient can get the drug is that their physician fills out the paperwork, and the drug is in a specialty pharmacy and is ready for shipping. I think it's too early to know how the insurance companies will place the product in terms of the tiering system. It will also obviously depend upon how the insurance company negotiates with the pharmaceutical company for the pricing of the drug. The one exciting thing about what the company has done is that they have priced the drug lower than any of the current injectable therapies. I believe that the company's patient assistance program is such that whatever the insurance company will not cover, the total amount of money paid by the patient is a very limited amount, and that essentially most patients should be able to get the drug without having to spend a lot of money. I think it's really exciting to have another drug on the market for our patients with MS. It's nice to have a second oral agent. The word of advice I give to my patients is that if you're doing well on your current therapy, don't make a change. It's always hard to know how each patient is going to respond to a therapy. So if a patient is doing well on their current therapy, if it ain't broke, don't fix it, don't switch. However, if a patient is tired of doing injections or wants other options or has failed their current therapies and there aren't any other options to think about, I think that Aubagio is a great option.
Well, I think it's important for them to discuss with their doctor about the side effects and the benefits that this drug may bring to them and weigh that against what they've tried in the past and what their other options are. I think one thing that has patients very excited about this drug is that it is an oral medication. So for them, that's a very positive thing as far as lifestyle goes. Even though there are these side effects, they really have not affected that many people. So most patients tolerate the drug very well.
For more information, visit the National MS Society website at nationalmssociety.org. And if you'd like information on the Patients Assistance Program, visit aubagio.com.